Hi, I'm Teresa Weezar, your host of 1 in 10. In today's episode, Twice the Harm, Children, Domestic Violence, and Abuse, I speak with Dr. Rebbe, Assistant Professor at UNC Chapel Hill School of Social Work. Now, there is no surprise to child abuse professionals that there's huge co-occurrence, really, between domestic violence and child abuse. But what do we really know beyond that once we begin to peel back the layers of these complex cases? As you will hear, too often these very sad cases involve our very littlest ones. In fact, 66% of children in the research we explore are too young, even to go to kindergarten. How can we keep them safe, while also not doing things that are harmful, like overexposing them to foster care, which we know has its own issues? And how do we tailor treatment and support to the reality of these complex cases, which not only involve abuse or neglect and domestic violence, but also the cocktail of serious mental illness and too often substance abuse as well? Most importantly, how can we intervene in a way that stops this cycle of violence so that both the moms, and yes, it really is mainly moms, who've experienced the domestic violence and the children who've been exposed to it, so that they can move from danger and fear to safety and thriving? I know you'll find this conversation as interesting as I did. Please take a listen. Hi, Rebecca. Welcome to 1 in 10.
Thanks, Teresa, for having me. Pleasure to be here.
So I'm wondering, how did you come to this work, really sort of investigating the intersection between children exposed to domestic violence and CPS reports and investigations and actions?
Yeah, so I think there's two primary drivers for this research topic. One is that there were some questions in LA County about how many kids were being placed in foster care or having cases open due to domestic violence. And this is generally something we don't have a lot of information about. There's generally not great data about domestic violence because that's not something regularly captured in data. But we had done a paper previous to this that was supported by the Blue Shield Foundation of California. And we had looked at hotline reports of domestic violence, and we had used a structured decision-making tool, which is a tool that hotline workers use when they're assessing calls that are coming in. And there was a binary indicator on that about DV. Again, we're asking these questions and brought it to us about, could we take this another step further to understand how many cases were being opened and how many kids were being placed into foster care due to domestic violence? So we were able to do that. I would also say we were fortunate because I'm part of the Children's Data Network. And so we have linkages of child welfare data from California with some other data sets. And because those kind of agreements were already in place, we were able to kind of jump into the data fairly quickly. There were some questions from the field that were being asked. We had some prior experience, so that kind of led us there. And then I think the second piece is that I have a background as a social worker working in a public child welfare agency. So I worked for 6 years for a state child welfare agency. And from that practice experience, I know how challenging and complex these cases with domestic violence and child maltreatment concerns can be. And also kind of knew that there weren't a lot of good data or answers about these cases. And so lending that lens to wanting to try to understand this problem a little bit better. So hopefully we can improve practice.
I always love it when someone's prior professional experience really informs the research that they're doing as a part of this, just so that we're level setting for our listeners who, by and large, are all child abuse professionals, but in different roles. So when we're talking about children exposed to domestic violence, what exactly do we mean by that? Exposed in what way?
Yeah, it's a great question. And I think it can mean a whole lot of different things. And again, I think that this is one of those limitations or challenges with our data is that we don't have a good sense of that because the variables that we have are very limited. But in general, I think that at least when these cases come to the concern of child protective services, that there is co-occurring concerns about children being injured or having their safety impacted by either domestic violence that is happening in front of them and they're actively being exposed to that violence, or that the DV that's occurring is impacting the parenting and posing a potential safety concern for the children.
When you're thinking about the study that you just did, which sort of, as you say, built on some prior research, what were the specific research questions that you were trying to answer with this one?
Our specific research questions were just kind of getting that sense of how many kids is this a concern for? We focused on this study on investigations. So because the previous study had focused on hotlines, we wanted to only look at cases where there were investigations. I think the key piece for this study was how many CPS investigators, when they were doing their assessments, identified that domestic violence was a safety concern for the kids. That's a specific way of answering that we looked at based on the data here. But then, so we wanted to look at, for those cases, the CPS investigator did identify a safety concern related to domestic violence. What did those cases look like? Were they different than cases that didn't have those safety concerns? We were also interested in if there were any co-occurring safety concerns. So what were the other major issues that were going on? And then we were interested in what were those case outcomes? So were these investigations resulting in case openings? So continuing on for services with court involvement, or in foster care placements for any of the kids involved?
In a minute, I want to get a little more into this, but one of the key things you were also looking at, I know, was to what extent there were sort of failure to protect concerns in the mix here. Mm-hmm. And I'm thinking in some states that framework is more familiar than others. Mm-hmm. So before we really get much further in the conversation, I'd like you to just explain to me and to our listeners, mm-hmm. What do we mean when we're talking about a parent, in these cases, a non-offending caregiver, right, mm-hmm. who might be indicated for failure to protect. And then after that, we'll talk a little bit about what the concerns are with that as an approach.
Yeah, so I think that at least the way that I can think of it or conceptualize it is if there is a parent who is not either willing or able to protect a child from harm by another person. In the domestic violence kind of scenario, we often think of this as like the non-offending parent or the parent who is experiencing the domestic violence. And if they are not able to ensure that the offending caregiver is not harming the child. So in some ways, it could also be thought of as like not removing the child from a domestic violence situation or whatnot.
So the underlying idea is that the caregiver has some ability to protect the child from witnessing the domestic violence or accidentally being injured as a part of it or something else, and they don't take the actions necessary to do that, or in some cases separate from the abuser, which seems to be how it's, often used in those places as well. And can you talk a little bit, because this kind of ties to your later findings, about why researchers and practitioners are now, I think, more concerned about this sort of failure to protect paradigm?
Well, I think there's concerns in terms of if a parent is found responsible for failure to protecting the child, that they're kind of being held responsible for somebody else's actions, and that they are essentially being blamed for what is happening, but is being done by another person. So like again, if they are experiencing the violence, that they're also being held responsible for that violence happening to them as well. And so there's concerns that that's not necessarily a productive burden for parents who are experiencing that kind of violence happening to them.
It seemed to me that there were kind of two, well, probably more than two, maybe 3 or 4 concerns about this. One is it's sort of a blame the victim paradigm. And so just sort of like at a basic human level, what's the fairness of that? I think the second thing that the paper pointed out, which I thought was really interesting and good, is that the nature of domestic violence itself is that it's coercive. Mm-hmm. And so you're applying a paradigm that rests on a foundation of believing that someone who is being abused somehow can escape that coercion, or it's as though they're not being coerced when in fact that's the fundamental issue in domestic violence, right?
Right.
Then it seems to me that the third piece of that was around, and maybe has more serious implications for the children than people's feelings about all of that, is that it also can result in separation from that non-offending caregiver. And I assume that is really why this became kind of a central issue in the papers, because the way in which there were concerns that this could drive foster care placement. Would you say that's fair?
I think that's fair. Yeah. And I think the other piece, to also kind of highlight is, domestic violence can be lethal. And so it's a very dangerous and concerning form of violence. And so there's some unpredictability and it's just very dangerous, which makes it also much more complex.
I appreciated you saying that, and also the paper itself pointing out that what we know from the literature now is that the point of leaving an abuser is often the most dangerous and potentially lethal
Hmm.
moment for both the survivor and the children. And so,
Hmm.
I think our knowledge and understanding about the complexity of that, is ever evolving and makes that calculation, I think, particularly challenging for folks who are sadly the victims of domestic violence and also trying to contend with parenting their children as well and protecting them.
Hmm.
So let's talk then a little bit about how common domestic violence is in these cases that wind up not only being reported to CPS, but ultimately investigated. And I noted in the discussion section that you were indicating, and that your co-authors in the literature, that we think overall there are estimates that 16% or something of cases might have this as a feature, but your findings, perhaps because of this is not just reports, but investigations, were significantly lower. But can you talk a little bit about how common you did find it in the cases you looked at?
Yeah, our findings are definitely, our numbers are a lot lower. And again, I think that it's how we are measuring the domestic violence being present in a case. And that's super important. We found about 6% of investigations had the investigator identified domestic violence as a safety threat for that case. Again, it's quite a bit lower than we had about 20% that were identified in hotlines in our previous study. Overall, how common is domestic violence in cases? It's hard to say because, again, the data is challenging and because it's not identified consistently. And I will also say that, like lots of things in child welfare, these concepts have different definitions and mean different things to different people. So what domestic violence means to me and when I might indicate that on a form might be different than you or someone else and whatnot. So I think, those are some of those challenges because domestic violence can look very different across different families. We found that it was about 6% of investigations had an indication of DV being a safety concern.
And was that at the point, just sort of time wise, when you were looking at whether it was present in the investigation, were you looking at it sort of at the point the investigation initiated or over the course of that investigation?
Yeah, great question. And so again, I think this is one of those challenges where you're trying to be as, one of the challenges in these data is being consistent so that you can follow things. It was the safety SDM or this structured decision-making tool. I think it was within a few days after the face-to-face that the investigator had with the family. And we chose that one because it was completed the most consistently.
Oh, that makes total sense. But it's just to say that one of the reasons that whether it's domestic violence or any other element that you're looking for, that doesn't mean it doesn't exist. It means at the point of time this form was being filled out, this was what was pressing on the mind and identified as a safety concern by the caseworker at that moment in time, right? Like at a single point.
Correct. And I would say that, again, we also chose this time point because the investigator would have probably talked to quite a few people, by this point and looked at the hotline. So it wouldn't be just like
a guess, right?
a guess or an initial assessment or just a copy over from what they got from the hotline. And it was consistently filled out. So did we probably miss some cases where their DV was a concern? Absolutely. I assume so.
How would we know? Yeah, right.
How would we know? And again, these numbers are definitely a lot lower than the hotline indicator. But again, I think that at the same time, I do feel a little bit more confident in it because I think that the investigator would have had a lot more information than, say, the hotline worker has regarding how valid the concern was.
Well, and I also think just the safety assessment itself, like one of the things that, and you've used this language, I think, in a very good and precise way, it's part of the safety assessment was determining to what impact it was impacting the safety of the children, right? Because that's what CPS
Correct.
is about.
Yes.
And so it's not to say there wasn't any other domestic violence, but it's the question about whether children's safety was impacted by whatever was happening in the home, right?
Absolutely, yeah. So there could be DV in the home that was not impacting the kids, and so that would not necessarily
Or
lead
in the
to,
past, or
or in the
sporadic
past,
enough
or
that it wasn't a concern to the caseworker or whatever.
exactly.
Yeah, exactly. All right, now let's talk a little bit about what percentage of cases that were substantiated had this feature of children being exposed to domestic violence in them, because I thought that that was a more concerning, number. Yeah.
Of cases that had DV indicated as a safety concern, 63% of them had an allegation substantiated or indicated, which was much higher than, cases that did not have domestic violence indicated as a safety concern, which was at lower at about 20%.
What conclusion do you draw from that? Because that's not an insignificant gap.
It's not. I think the main thing is that I do think that it is when you're identifying it as an active safety threat to a child, that's an important, that you'd find a relationship, that if you're going to say that it's a safety threat, that substantiating the allegation would make
would
sense.
Be the
that
next
it would be more
logical
like
step.
Right.
Yeah.
I will also say that there's an interesting piece of substantiations. There's lots of debate of whether that's how valid that is of an indicator or whatnot. In California, it is fairly significant in that there has to be a substantiation for cases to continue. So if to open a case, there has to be some sort of substantiation. And that's not the case in all states, including the one I practiced in, where substantiations and case openings were separate. So that also could be an indicator of if they wanted to provide services, they needed to substantiate so that they could do that.
Well, and that answers what would have been my next question, which is I noticed that the case opening rate really closely mirrored the substantiation rate. And you're saying that this is why, that if they wanted to provide services at all, it needed to be substantiated in order to open the case.
Yes, that is my understanding of how things work in California.
Now let's talk about placement outside the home for a moment, because I think that that's another thing that, we're always concerned about placements outside the home. And while we know that there's some percentage of cases in which that's going to be a necessity because kids can't safely be in it, we also know it causes trauma to kids, that sort of family separation. So what did you find in your study about the co-occurrence between, children who've been exposed to domestic violence and their likelihood to be an out-of-home placement?
Yeah, so we found that of the investigations with DV indicated as a safety concern, that about 30% or so had at least one child placed out of the home within 60 days. I think folks will often, want to ask, is that the right number? Is that the right removal rate? Is it higher or lower? Hard to say because, again, it's hard to know exactly what's going on with these cases. But I think that at least for some folks, I think that number is probably lower than they might have expected, or at least that was, some of the impetus for this paper, that there was concerns that it was higher.
Yeah, it's interesting you say that, because that was also one of the things that I wondered about, is whether people had initially thought they would have a much higher rate of out-of-home placement. And in fact, as you say, without getting into a lot of qualitative information and case notes about the seriousness of what kids had witnessed or experienced or whatever, with this, it would be hard to determine whether 30% is the quote unquote right number or not. But at any rate, it didn't seem to be driving an exorbitant rate of out-of-home placement, even though 30% is certainly not an insignificant number.
It was definitely a lot higher. It was 8.7% of cases that did not have domestic violence indicated as a safety concern resulted in an out-of-home placement. So again, similar to substantiations or in case openings, much, much higher than when it wasn't indicated. But again, I think, to your point, maybe not as high as folks had thought it had been.
One of the things I was struck by in the paper as well is you talked about the age of children who were involved in these cases where kids had been exposed to domestic violence and how that compared to the general sort of CPS population. And in your paper, you noted, I think, about a little over a quarter were infants, 40% were between 1 and 4 years of age. I mean, if you add that up, 2/3 of the cases involve these very, very young children. And I wondered, to what degree that also influences that 30%. Do you know what I mean? And why it's
Absolutely.
even as high as it is?
Mm-hmm. Yeah, absolutely. And I think we saw that in our regression models. We're including a lot of different variables in there that if there was an investigation that had an infant on the case, that increased the likelihood of both placements and case openings, which also makes sense in terms of, the vulnerability of infants, and young children when they're not as able to, one, protect themselves, but then also express to others, what they may be seeing, or what safety concerns they may have for themselves.
I mean, I think that most people who've been in the child abuse field very long have had a case where a caregiver was holding an infant in arms and was being abused. And what can happen in those situations where a child is easily injured, or involving toddlers who, with older children, they'll tend to flee to their bedrooms or get in a closet or leave the house and go to a neighbor's or whatever. But if you're a tiny little one, you can't do any of those things. And so I think that it makes sense to me that caseworkers would be much more alarmed about very, very young children being exposed to domestic violence, perhaps in terms of an immediate safety risk, than older children.
Yes, absolutely. Folks who have worked in the field have seen it, and it's definitely something that rings true in terms of the safety and vulnerability. And I think like the statistics support like when we're talking about fatal maltreatment.
That's right.
The younger children are the most likely to experience fatal maltreatment.
So now let's talk about who did the reporting, because that was one of the things that, to be honest, I was a little surprised. I don't know if I assumed that more neighbors were hearing this and calling it in, or, concerned grandmas or what. But in this, you just had an overwhelming number of law enforcement.
Mm-hmm. Yeah, and I will say that is consistent with our previous study on the CPS reports at the hotline level. My interpretation of that is that law enforcement's probably the most likely to see it. They're the folks who are being called out to respond to concerns of domestic violence in homes and whatnot. Because, again, how we're measuring domestic violence as a present safety concern for kids by the investigator, I think that reports that come from law enforcement who may be reporting about an active situation, as opposed to a neighbor or a teacher who might be reporting it more retrospectively, that leads credence or credibility to those concerns. And so that could lead to the investigator identifying it as an active concern. I would also say that if the domestic violence is getting to a point that the police need to be called as well, also might be an indicator that the DV is more severe or more concerning, or more of a safety threat than DV that is being reported by a neighbor or a teacher if it hasn't gotten to the law enforcement stage.
I think you raise a really good point, which is if something is happening that is serious enough that a neighbor might call, they're calling 911, and that's going to get a police response, and then the police are going to be the one who reports it. I also think that another factor in this, because this was looking at substantiated cases too, is that we know from other literature that law enforcement reports are more likely to be substantiated than those by other mandated reporters, other entities, that kind of thing. So that also may play some role here. But I think it's right that you can imagine police have responded to a DV call. They're out in a house. They're a bunch of kids. There's a concern in what they're seeing. They're going to call that in, and that's going to start this ball rolling. When you think about the co-occurrence between this, though, and other forms of maltreatment, I have to say, I was not surprised that general neglect popped as high as it did. I think it seems like we see this from lots of different points. Usually I'm talking to a researcher about neglect and they start talking about domestic violence. Now I'm talking to you about domestic violence, and we're going to start talking about neglect, because these things seem to be intertwined in the way that they are. Can you talk a little bit? That wasn't the only thing that was of concern that was co-occurring, but can you talk a little bit about this sort of complex relationship between kids who are exposed to domestic violence and general neglect and other co-occurring risks that are in the home?
Neglect is a challenge, and I know you've talked about the challenges of neglect on other episodes on this podcast, and I've written about the challenges of neglect in other papers. It's hard, again, it's similar to DV, it's hard to know what folks mean by neglect, or what it could be including. I think for some cases, neglect, especially general neglect in California. So California is weird in that they have a severe neglect category.
I see.
But I think in for general neglect, I think that it sometimes turns into a little bit of a catch-all for something's, things aren't going well. We have concerns. We're not entirely sure. It's not quite physical abuse. It's not quite emotional abuse. We'll say it's neglect and carry on. And again, I think the challenge is that that can encompass lots of different things. And so it can be hard to kind of disentangle what does this mean. And in a lot of cases, I do think that neglect means domestic violence. Not always, but I think it also sometimes means substance use concerns and mental health concerns. And so it's hard when we talk about neglect because it's hard to know exactly what we're talking about.
And I also think, to your point, the lack of specificity also means a lack of specificity in effective program responses.
Mm-hmm.
If we're
Mm-hmm.
using neglect as a catch-all, like what would you say is a great evidence-based intervention for general neglect, in quotes, right? Can you even think of one? So
No.
it's like, so I think that this, without turning this conversation into a completely different one, it's like one of those things that I think is something that requires a little more focus and investigation and talking and policy making around, is that as a category something that may have outlived its usefulness in being characterized in such a broad way? But I have to say, I was a little surprised by the current co-occurrence numbers with child sexual abuse being so low,
Mm-hmm.
because many of the listeners work predominantly in child sexual abuse or severe, meaning criminal physical abuse. And I can't say that we have any lack of cases of domestic violence. So I'm curious. I don't know that there's an answer to this question about why it seemed to be as low as it was at, I don't know, what, less than 2% or something for child sexual abuse. But it did make me wonder about that.
Yeah. I don't have an answer. My suspicion might be that the young age, of
Right. The
most of these
below
cases.
four. Yeah.
Right. And so I think that might be more of the explanation, but hard to say. Yeah.
Yeah. Well, I think it's a good one because the kids are not very verbal at that point, at the point that we're looking at the population that we're talking about. And so, most CSA comes forward by kids who are school age or certainly verbal. So it's a good point about just the way that skews affecting it. One of the things I was really struck by because I liked the table that you had, which listed all the elements sort of in this safety. Tell me what the name of the tool was again.
The structured decision making tool, SDM. Mm-hmm.
Thank you. The
Mm-hmm.
structured decision making tool. And what I
Mm-hmm.
was struck by overall wasn't just the way in which this population compared to the cases that don't on any individual item. But
Mm-hmm.
when I look down that chart across every single item that you look at, the kids who are exposed to domestic violence those cases have increased risk compared to those that don't have it on every single element.
I think that's the most fascinating charge
Me
of the
too.
paper. Um, and I think it, at least for me, the thing that strikes me is that when we talk about, these CPS investigations with domestic violence, these are complex cases because it's not just domestic violence that's the issue, that there's a lot of other things that are often going on. So, 30% that involved concerns of substance use by parents, 14% involving mental health concerns of the parents. So these are complex issues. And so when you talk about, substance use and domestic violence together, both impacting parenting, those are hard cases and complex cases to kind of disentangle and to figure out services and safety and et cetera.
When I was looking down that chart, one of the things that I was thinking would be interesting to know is how many of those items tend to load on any given case.
Mm-hmm.
To what percentage of cases have two of those, three of those, four of those, five of those in whatever mix? It would just be so interesting to look at that.
I believe we did look at that at some point during the writing of the paper and decided to go with this one for simplicity's sake.
Yeah.
But I think you're right that there's more work to kind of be done and to tease those out and understand, especially some of those cases that are highly complex and there's a lot of those different pieces going on.
The other thing is it's not just that there was more of things or there would be more likely. And sometimes it was 5 times as much, 6 times as likely, 7 times as likely, 8 times as likely. I mean, these are not small differences. And one of the things it makes me think of is to what extent, from a policy perspective, we're allocating resources at a scale that deals with the complexity of the difference. You know what I mean? Like we don't want to say that any case is like the usual CPS case, but to some extent, there are some cases that follow a relatively typical pattern and a relatively typical array of interventions can be offered that are likely to be successful. And many of those have a lot of evidence behind them. So we have a good reason to think that if the parent completes them, they're on a path to success. Here, you were talking about something with so much complexity and so much additional, really safety risk that's attached to it, that I think it's, in the discussion section of the paper, it sort of talked about that a little bit. And I'm wondering what you see as implications for policy and practice of your paper.
I do think that the complexity of these cases is a huge piece, and understanding that this paper talked about cases with DV, but really, like it's not just DV for a lot of these families in a lot of these cases. And so there's a tendency to sometimes do that when we talk about cases with certain issues or concerns and think that it's a sole issue that families are facing, when often it's complex like this. So I think that in tandem with the fact that a lot of these kids were so young, is that there's a need for intense services for these families. We talk a little bit in the discussion section about some different programs that some jurisdictions have tried out. When these cases go to court and go through that process, that can be a very overwhelming and challenging experience for families. And so I think that some of the programs that are specifically tailored to either young children or focused on a specific issue and then have a lot of like high touch wraparound can be helpful, while also realizing that it's also asking a lot of families to be involved. But I think that thinking creatively about multidisciplinary teams and working across, lots of collaboration is needed for these kinds of cases, which require a lot more funding and a well-trained workforce.
When you were talking, I was also thinking about, and I was glad you pointed out some cases of sort of positive variance, some examples that might be working well other places. There was a safe babies in court or something, which sounded like sort of a court-ordered sequence of events or sequence of interventions as a part of it. I don't know those programs, but I appreciated the fact that by including them, there's something that people can look at as possible examples of things to try. I also remember in the discussion section that you guys identified that sort of what hasn't worked well, and that there's some evidence that when there are these complex situations, trying to just sort of like treat everything at once, to your point, is overwhelming, and there's not good evidence that that's terribly effective.
I can remember, when I first started as an ongoing worker, and it's like, what services do you want, the court to order? And it's like, it can be a hard thing for caseworkers to kind of figure out and for families to figure out and whatnot. So I think, a main point there is to be very specific and make sure that the services are in line with what the family needs. But I think that it also takes a little bit extra time in sitting with the family and understanding what their needs are, what they think would be beneficial, and taking that into consideration so that it's not just a boilerplate, this is what we have everybody do, because it probably won't work. That's not effective and not the purpose of what's going on.
Well, I think that because because these are complex and because, quite frankly, a lot of what has occurred in these cases is like general family breakdown, general family dysfunction, like lots of things are compounding each other and going wrong. You're trying to pick something that can also, I mean, you have to deal with safety first, of course, but beyond that, what would feel like a win? What would feel like success to the family? Because
Mhm.
I can imagine for the non-offending caregiver, especially, you're both literally and emotionally beaten down by this entire process. So, what gives you a sense of self efficacy? What gives you the sense that something can get better? I think is also an important piece of the equation in all of this.
The other thing that makes domestic violence cases particularly complex is that there's usually more than one court system that's involved, right?
That's right.
So you have the family court involved in addition to the child welfare dependency court. And so I think that just highlights the importance of having, and maybe even the criminal court, the importance of having that collaboration among all the parties involved and service providers, including the DV advocates and attorneys and service providers. So I do think that it requires a lot of communication, a lot of collaboration, team meetings, et cetera, that these aren't simple cases. And so just send them to one service that's going to fix it all. I think, as you said, that these are, there's a lot going on for these families. And so there, in turn, that requires a lot of services and coordination.
Well, I appreciate you saying that, and it's music to our ears because so many of our listeners are children's advocacy centers who coordinate multidisciplinary teamwork and, are just huge supporters and fans of that kind of communication and collaboration. Where does your research take you next? What are you working on that you're excited about right now?
Yeah, great question. There's lots of things. I think that there's definitely some paths regarding domestic violence that, would like to continue on. There's pieces of some other populations, populations where it's kind of just unknown of, what their experiences with CPS are. Also looking at some community level predictors of CPS involvement.
Well, we'll look forward to seeing those publications when they're all out and about. Is there anything else that I should have asked you and didn't, or anything else that you wanted to make sure that we talked about today?
One thing I will highlight, I don't get to say this very often, but this paper was published as open access. So it is out there for everyone to use and to pull off the internet for free, which is great. I think the other thing that is important to say, and I think I've alluded to it a little bit, but just how I do think that domestic violence is a very important and critical issue and that we really don't have good data. And so, we were lucky in that we had access to some data in California to allow us to look at this data. But, when you look at like NCANS, which is the national data set, states use there is a DV indicator in there, but it's used very, very infrequently.
Interesting.
So, or at least not consistently across states, across years. So I think that's been a real impediment to our understanding these kinds of cases, which is a disservice because I think we need to know more about them. I think we've been very fortunate that we've had the cooperation at the Children's Data Network with the state and county who want these kinds of data-driven answers and analyses. And so I think if more states and jurisdictions were open to building those kinds of research partnerships, these kinds of data analyses could happen more often.
Well, I'm hopeful that after this podcast airs, somebody will reach out to you from another state that's willing to take this on. Because I agree with you. We're all about learning more from research. So appreciate you coming on and sharing your knowledge and hope to have you back sometime when you've published something else on this topic.
Absolutely. Thank you so much for having me.
Thanks for listening to 1 in 10. If you like this episode, please share it with a friend or colleague and check out our video episodes on YouTube at NCA for CACs. For more information on this or any of our other episodes, please visit our podcast website at 1in10podcast.org.